An employee gets cut. He's bleeding. His blood is on the saw, has dripped on the floor, and he needs attention. He goes to his supervisor or one of the first aid responders, maybe you. How you respond is very important, not only to the injured employee, but to your health and the health of other people working in the area. This program is presented to help you know the steps you need to take to comply with the company's infection control and bloodborne pathogens exposure control policy. The policy is established to do just what it says, to control infection and to control the exposure of yourself and other employees to bloodborne pathogens. So what is a pathogen? A pathogen is any disease-producing agent, a virus, bacterium, or other microorganism. One can never know for sure if the person you are responding to has a bloodborne pathogen, so the safe step is to assume they do and take the appropriate steps. These steps are often referred to as universal precautions. They are used to minimize and control your and other employees' exposure to the injured person's blood or other potential infectious materials, such as saliva or vomit. A pathogen, one in the blood or other bodily fluids, can be transferred by coming into contact with your skin, your eyes, your lips, or tongue. Using universal precautions is a vital step toward protecting your health and the health of our employees. First, get some gloves from the first aid kit and put them on. Do this before you inspect the injury or touch any clothing or material that is bloody. If the injury is severe and blood is spurting out, you should also make sure you're wearing safety glasses with side shields and a surgical mask. In circumstances where you need to perform CPR, you should use the CPR mask with a one-way valve. In the first aid area, there should be a supply of materials required for such circumstances. These include disinfecting cleaner, antibacterial soap, biohazard waste disposal bags, gloves, surgical mask, and biohazard labels. Once you have bandaged the cut or wrapped it for protection and arranged for the employee to go to an urgent care facility if necessary, you then have some further steps to take. In the first aid area, you will find a supply of red biohazard bags. Use one of these bags to dispose of any items that came in contact with the injured employee's blood. This can include rags, gauze pads, remnants of clothing. Anything that got bloody should go into a biohazard bag. This also applies to any other potentially infected material, such as saliva or vomit. Now is the time to obtain an appropriate disinfectant to clean any bodily fluids from the tools and work area. This disinfectant should also be found in the first aid area, either by the first aid kit or as part of a bloodborne pathogen kit that is placed in the area. The cleaning of the tools and the area must be done very thoroughly, and employees should not be allowed to use the tools or work in the area until the cleaning has been completed. It may be necessary to lock out the saw to remove the blade and to clean all areas where the blood might have splattered. It may be necessary to use an absorbent material such as sawdust to absorb the blood or other potential infectious materials. During this cleaning, it is appropriate for you to continue to wear the gloves, safety glasses, and surgical mask. Should you not be able to properly clean a tool, a biohazard warning label should be applied to the equipment, and all employees using that equipment should be informed of the hazard. Once you have completed cleaning up all tools and work areas that were contaminated, you need to also dispose of the cleaning materials in a biohazard bag. This should include the safety glasses, surgical mask, and gloves. Once you have done that, you should use a disinfectant hand soap to thoroughly clean your hands, arms, face, and any area that might have come in contact with blood or other potential infectious materials. Dispose of the red blood-borne pathogen disposal bag by sealing it and placing it in the dumpster. An additional aspect of our program is the opportunity for any supervisor and first responder to receive a hepatitis B virus vaccine at company cost. Contact or exposure to blood is not needed. Just being in a position of responding to an injured employee qualifies you to receive this vaccine. And one final important note. If we respond to an injured employee and do not use universal precautions and the procedures described, all involved employees and the supervisor of those employees must submit a written report to the branch manager within 5 business days, describing what was done and why the specified procedures were not used. This report must also be sent to corporate safety. The Infection Control Bloodborne Pathogen Policy is always available to you in the Public Safety folder on the company drive. Should you not have access to that, your manager can provide you with a written copy. In summary, compliance with the Infection Control Bloodborne Pathogen Policy requires that we maintain all appropriate materials in our first aid area, that those who respond to injured employees use universal precautions to prevent infectious diseases from spreading to themselves or other employees, and to thoroughly clean any areas exposed to blood and other potential infectious materials. These steps are critical steps we must take to protect the health of all of our people.